They ranked one of the major providers, telehealth, Teladoc was ranked the highest in customer satisfaction among direct-to-consumer brands with a score of 874. MD Live ranks second, and My Telemedicine 859 ranks third. United Healthcare ranks highest amongst payers, with Humana and Kaiser tied for second. It's interesting. I don't think I've used my provider telehealth, but I have used my payers telehealth. It's included in my plan. The initial visit is free because, quite frankly, it saves them money. They get to direct my care and make sure I don't overutilize or go to the wrong place and that kind of stuff. So I guess there's a benefit in that. And both my wife and I have started visits in that direction. And in every case, we never ended up at the provider. Like, it was taken care of without ever going to the local provider network. And I think that's one of the things that healthcare providers need to be aware of, is that that's the point of entry, I believe, that everyone's trying to get to, which is, we want to be your first call. CVS wants to be your first call. Your payer wants to be your first call. Amazon Care eventually wants to be your first call.
Amazon.
Employer. Transcarent is a new model that Glenn Tolman's bringing out. They want to be your first call for an employer plan. Everybody wants to be your first call, because if you direct the care, you control the experience, you can drive costs out of the equation. And I think that's where people are starting to find the dissatisfaction with healthcare, is in transparency and cost. And they're saying, all right, if somebody else can help me navigate this to drive out my costs. And a lot of times I hear people say, well, you're not paying for it anyway. Well, I sort of am. I'm an employer. I have people on my insurance plan. And yeah, I don't want to just use that, because eventually what that's going to be is higher premiums for me next year. And so that's why we're investing all sorts of things around wellness, programs for stretching and programs for things that keep you from injuring yourself and whatnot. Those are valuable to employers. And we're trying to drive costs down. And it's that first phone call. I guess the question I have is, can providers step into that gap? And are they going to step into that gap of being that first phone call to help direct care?
I think they already are in many cases. And I think it's absolutely crucial as we see things move toward a more value-based care system, where it's a move toward true health assurance, toward wellness as the focus, and not just sick care, fee for service. And even those fee for service systems that are slow to move into at-risk models, if they can do a better job, drive cost out of the system, be more efficient, it's going to help them negotiate their insurer rates, their payer rates with private insurance, and move in a better direction from a business model standpoint. But the other thing that's going to drive it, honestly, I truly believe, and it's been happening and it's been accelerating, is the consumer expectation that those technology tools will be available, and that it's not just that you could be my first call, it's that you are the first call that's easiest for me, that has the best experience, that gets me what I need. That's what's really going to drive success in the space. So it's not enough just to have an option. It has to be a good option. Yeah. Convenience is king and experience is everything.